you're ready, you can come off mute, take off.
Awesome. Well, I'll get started as Natalie's getting ready to share some awesome information with you. My name is Tasha Thomas.
Oh, why
Um,
can't I hear?
I'm a lead education alliance specialist. So I work with Karen in Florida, Kentucky, Georgia, Alabama, and Tennessee. And I'm really excited to be here today, mainly as a support to Natalie, but also just super excited because Kentucky has been one of the areas that Karen has wanted to connect with and work with for so long to help support with our prevention and intervention services. So this is actually just a treat to see all of your faces. Super excited to be here. Hopefully we'll be able to provide you with some great information and in the future, some great support around how to help our kids because we know that we need it. Now I'll turn it over to Natalie, who'll be your main presenter for today. Thank you.
Thank you, Tasha. I just echo what she says. It's so nice to meet you all. I'm actually the Education Alliance Specialist for the Kentucky region. So for the past year, I've been doing some outreach and trying to get our services and support into different areas. I'm based in Louisville and I'm from Louisville. And I've been doing outreach in the surrounding 7 counties, but we also offer a lot of support that's virtual. And so Beth and Quentin asked me to come in today and provide some support. So hopefully it is useful for you all related to providing really all around support for substance use prevention and early intervention for young people. So today I have a PowerPoint. I'm going to share that. We'll get into a lot more of the specifics, but how it's going to really go down is the first 30 minutes or so. I'm going to give some background on just some substance use trends that we're seeing in young people. And then we kind of have like a brainstorm, just what you all are seeing in your schools, because just every school is different. Every region is different. And then we'll get into what services we provide and if there's any potential for collaboration or any other ways that we can support you all. So I will share the PowerPoint. Like Quentin said, we do have some interactive slides. You can take yourself off mute and interject, but because we kind of have a bigger group today, it might be best to just put it in the chat and Tasha might help me monitor that and we'll interact that way, just not to take up too much time because we only have an hour. Wish I had way more longer to get to know all of you, but we'll do the best we can. So I'm going to share now. Okay. Okay, can everyone see this? We're good? I'm seeing some thumbs up. Great. And I definitely can't see the chat, so you'll have to help me out.
I've got
Okay.
you.
All
No
right, thanks. All right. Well, thank you all for coming. Like I said, we are from Caron's Education Alliance, and they're part of an organization called Caron Treatment Centers, and I'll explain that in a little bit. But to get started, like I said, we'll go through some introductions. I'm going to go over an overview, about 30 minutes of some substance use trends from recent data and just what we're seeing. I'm going to go through some brief prevention and early intervention tips that you can take with you. And then I'd like to have a discussion with you all, just what you're seeing and how we could potentially support with the programs that we have. So that's our format, but Tasha and I have introduced ourselves. I guess a little bit more of a background for me. I graduated from Western Kentucky, and then I left the state for a while to do some other degrees, had another job, and then I've been back in Kentucky for the last couple of years. And so I'm really excited to be here and give back to the community and the state and support you all in what you all do. I have a master's in public health and a doctorate in clinical psychology. So I did clinical work for like 3 or 4 years and then decided I just wanted to do prevention. I'm super passionate about prevention. I think it's a very needed and overlooked area for helping all of us and overcoming challenges. And so that's why I'm really passionate about this work. But for you all, I might stop sharing so maybe I can see the chat. if you could just tell me your name, what school you're at, and then maybe what brings you here or what you're hoping to get from this, that would be super helpful. Just give you a few minutes to put that in there. Or if there's a few brave souls that would like to unmute, you could also maybe just say what school you're at and what you're hoping to get from this. That could be nice too.
Hey, I'm Erica Sexton, and I am the Bergen Family Resource and Youth Service Center Coordinator, and I'm new to my position and don't really know a lot about substance use.
Okay.
So I feel like the more knowledge I can gain, the better.
Yeah, great. Happy to have you.
In the chat, Natalie, Brooke shared that looking for skills that can equip parents and help them have, the language that they need to best support their kids, which is really important to help them have those conversations. Crystal is wanting more information regarding adolescent substance abuse support. Thank you, Crystal. New ways to connect with our students who are living in homes with substance abuse and how to help them choose a different lifestyle. That's a great talking up a lot. Learn more about prevention services for my students and their guardians. Learning about new trends and how to get through those tough conversations, just even how to start them, which is important. These are great. This is great feedback for us on what the needs are. So I love that. Stephanie says strategies to address issues in an impactful way. There's so many things that we call prevention, and they really don't have that meaningful impact. So she's really looking for something that kind of packs a punch. What can we do to have some great impact? So lots of great sharing. We're going to save the chat and take notes because this can help us as well as we're driving our services to meet those local needs. So thank you all so much.
Yeah, thank you so much, Tasha. And thank you all for sharing. It's always so interesting as well, because it's always evolving and we want to stay up to date because that's the best way that we can support you all. Okay, so now we're going to do a little bit of an icebreaker. Once again, we'll have to do this in the chat. And you can just put this, it's on a scale of 1 to 5. So we'll do the first question, which is how familiar are you with Caron treatment centers? So 1 is no clue. And 5 is, I can't see what there's one, expert. 1. Okay, lots of 1s. 3, 1, 1. Okay. All right, so we'll do the next one. How long have you been in your current position? So 1 is less than 1 year, and 5 is 15 or plus years. So we have some middles and less than 7 years, less than 1 year. Nice. Okay. And then the most important one, coffee or tea? 1 is coffee, 5 is tea, in between is both. Ooh, it's a little bit of mixed.
Erica, either. I'm always like curious. Yeah, Erica's in here. Lots of coffee drinkers. I was about to prepare my coffee before this, so that's nice.
Oh,
yeah,
pop.
there's a pop. Okay.
We don't have pop on here, so that should also be on here. Okay. It's just a little fun to get us started. Okay, thank you for sharing. Yes, so Caron Treatment Centers, a lot of you said you are not aware of them. So Caron Treatment Centers is a residential treatment facility providing support for families impacted by addiction and mental health issues. They've been around for 65 years. What's really fascinating about them is they're founded by a man named Richard Caron. So that's why it's called Caron Treatment Centers. And he started this based out of the need in his area, particularly around alcoholism. And it was very innovative at the time, just because there's so much stigma. and he actually called it Chit Chat Farms. And Chit Chat Farms has now evolved into Caron treatment centers. And so our main hub is in Pennsylvania, and then we have another treatment center in Florida. And then in the 1990s, they started to focus more on prevention. And that is when Caron's Education Alliance came to fruition. And so the whole intention behind this was, how do we prevent people from even getting in the beds in the first place? And really the best way to do that is to work with youth and the people who surround youth. And so I started working in the schools in Pennsylvania, and they've now spread into different states, which I'll cover in a little bit. So now we're just going to go into substance use trends and have a discussion around really what teens are using and some background information. Sorry, my PowerPoint's a bit on a lag, but I'll just give it a moment. Okay, here we go. Okay, so this is data from the Monitoring the Future study, which was done in 2023. So they survey students every year, and particularly 8th, 10th, and 12th grade. And so for 2023, they had 14,000 students. And this data point is really just all substances. So in the past year, have you used any illegal substance? And the top line is 12th grade. So we're looking at 31% of 12th graders, 19 to 20% of 10th graders, and 11% of 8th graders. And so we're going to break this down by substances, but this is just have you used in the past 12 months. Some things to keep in mind is that obviously this is in the post-COVID landscape. So obviously these numbers range from region to region, from school to school. There's been a lot of policy around surveying kids, and there's been, as you all know, a huge uptake in school refusals. So some of this might be a little bit skewed, but overall, this is the data we have and does provide some type of snapshot. So that's just to say it could be more or less where we are. But the other thing to just keep in mind, which I think is an important reminder, is that most youth are not using substances. So obviously the use is really high, and we still need to see that as a concern. But I think sometimes our perception gets skewed, as in, is this actually the majority? And the answer is no. So this data is using cannabis, alcohol, or nicotine in the past month. And 62% of 12th graders are not. And almost 77% of 10th graders are not, and 87% of 8th graders are not. So this is just to keep in mind that majority of young people are not using substances, even though the numbers are high. It's just important to keep this in mind. Okay, now we're going to go into the different substances, and we're going to start with a trivia question. So, sorry, it's on a lag here. What do you all think? What is the most frequently misused substance by teens? We have nicotine, marijuana, alcohol, or Adderall. So if you could type your response, see what we got. I can see some. Okay, lots of nicotine, vapes in general, marijuana, THC, nicotine, alcohol, marijuana. Okay, so I think we had one person, Brooke. You said alcohol, and you are the lucky winner. This might be a little bit surprising because alcohol use has been steadily decreasing, but it still hasn't tipped the scales with marijuana and nicotine. Vaping use and nicotine and marijuana use are obviously skyrocketing, and that is what we focus on. But it's important to realize that at the moment, based on this 2023 data, alcohol is still the most popular substance. And not by much when we look at like 10th and 8th grade, but particularly for 12th grade, it's higher than nicotine and cannabis. So we're going to go into each of these. So the most popular substances that are used are alcohol, marijuana, and nicotine. And so we're going to go over those three just briefly to talk about the trends and a little bit about their background and their ill health effects. So we're going to start with alcohol. From this study, the Monitoring the Future study, it remains stable for 8th and 10th graders compared to 2022. So not really a lot of use, and it's actually decreased among 12th graders. So the overall trend is that alcohol use is decreasing, but it's just important to stay aware of it. You know, be on top of it. We know the ill health effects of this, and just to be aware that it is still happening. And some of the trends with alcohol haven't changed that much in the last 10 to 15 years. They're not evolving as quickly as we're seeing with different vaping devices. But it's important that, you know, to be aware that there's certain empty containers that they'll hide alcohol in, right? So this is a bangle or a bracelet, a water bottle. These are all kind of common ways to hide alcohol. You can also eat it now in different types of food. It can be vaporized. And then really these hard seltzers are kind of the newest thing. I mean, they look like regular drinks and they can be deceiving in how quickly you can become intoxicated. And then the thing to also keep in mind is that even though binge drinking and alcohol use is on a decline, most teenagers are drinking just to get drunk, right? They're getting just to be intoxicated. And that comes with a lot of risk. It really impacts your decision making and puts you at risk for violence, poor decisions in general. And then the other thing I just want to mention about alcohol before we move on is it's been studied from a prevention perspective more than the other substances. And so the data is super fascinating that if a young person starts drinking before the age of 15, they're 5 times more likely to develop a dependence than somebody who starts drinking at the age of 21. And I'm going to go into this a little bit more about prevention and the developing brain, but I think this statistic is really important because it applies to the other substances as well, which is that it just puts you at a higher risk for developing dependence and addiction later. And so delaying use is just super important for all substances. And that's what I tell the teens when I work with them as well is, you know, I'm not trying to take this away from you. I'm not trying to tell you what to do. But if you want to have, you know, the healthiest brain and body possible and have more control over your life, it's probably important to delay use. Just wait. Okay, now we're going to go into nicotine, some more trivia. So according to the National Youth Tobacco Survey, e-cigarettes are the most commonly used tobacco among all students. Okay, here we go. True, true, true. Lots of trues. Anyone else? Yeah, pretty unanimous. This one is definitely kind of a giveaway, but yes, it's true. It is definitely the most commonly used tobacco product. And then we'll have another one. This one's a little more difficult. What's the most commonly used brand? Does anybody know this one? We got an Elf Bar Jewel, Elf Bar and Jewel. Ooh, Esco. Elf Bar. Okay, yeah. So all of these are popular. So anyone who's putting them in, but obviously different areas have different trends. But based on this survey, the answer is Elf Bar. So let's look at some of the data. This is from the National Youth Tobacco Survey in 2023, and they found that about 2.8 million youth are currently using any tobacco product. And what they found was that use decreased among high school students, but it increased among middle school students. And I think that's kind of what we're seeing, is that this trend is starting younger and younger. I've talked to Friskies in this area and in other areas, and they're saying it's as young as 4th and 5th grade. So it's just something to be aware of, that that is what's increasing. And then we need to start intervening even earlier. Of the 2.8 million that are currently using tobacco, 2.1 million are e-cigarettes. Like we said, e-cigarettes are the most popular. These are the vapes. And more than 1 in 4 youth are currently using e-cigarettes daily. And so you can see the breakdown of the most popular products. So Elf Bar was there at the highest, but these are always evolving and changing based on regulations and the tobacco companies kind of adapting to what is popular among youth and their constituents, but also the legal ramifications in each state. So these can change pretty rapidly. But from 2023 data was Elf Bar. And the 9 out of 10 are flavored. And so these flavorings are very important because obviously they're targeting young people, especially with certain flavors like Fruit Loops and Lucky Charms and marshmallows. It's like, that's not for adults. So that's just to keep in mind. And then I'm just going to go through some awareness of these products and how they evolved. So they've gone through multiple generations, and we're already in a 5th generation. And I'm sure we'll continue to have this as, the scene morphs and changes. But really, e-cigarettes were developed because they were seen as a healthier alternative to cigarettes. And so that's why they came on the scene. And since then, they've adapted. So they've gone to refillables, they've gone to cartridges that you can charge over and over. And then now the most popular is disposables. So right now there's 3 different types of systems. This is called the closed pod system. These are devices like Juul that can be recharged. So you have a little piece that you charge, and then you have another piece that you buy and can be replaced and disposed of. And then we have the open pod systems. So these you don't throw away. You keep the pod, and then you buy juices that go into them. These are more expensive. They require more upkeep. They're seen with more like experienced users that do lots of tricks and blow different shapes and all kinds of things. So, and you can see some of the flavors on the screen that are a little bit ridiculous, but these are that type of system. And then we have right now, which is the most popular, which are the disposable products. And these are more popular, one, because they're cheaper. They come in more flavors. They're easily, you can hide them easier. You just use them and throw them away. It's about 200 puffs per stick. And yeah, so it's just more appealing at the moment. So those are the ones. You can see the Elf Bar in the corner. That's the one that's the most popular according to the survey. And I'm sure what you all are seeing. So yeah, that's just a brief overview. So here are just some reasons that some teens are drawn to vaping. I'm sure you all know about these reasons, but it's just to be aware of that this is what draws them in. A lot of it's peer pressure. A lot of it's the culture around vaping versus, marijuana and nicotine. It's easy. It's seen as healthier and safer. And then once you get into that, you start to experience the emotional component, which is its stress relief. And then you want to keep doing it over and over. And then they're, hooked on it just because there's such a higher risk of addiction because our brain isn't developed. And in many ways, why they try it is quite innocent. But because nicotine and now these high levels of THC and marijuana are so addictive, they get kind of tied to these devices. And I've worked with older teens, like 17, 18, and it's sometimes really disheartening because they're like, I started vaping when I was 12 and I just don't know how to stop. And this speaks to just the brain development and not having the skills we have as adults to have more control over our use. And I'm going to go into that a little bit more in a second. But here's what we know about these devices. So the vapor is not just water. The liquid has been studied, and it contains heavy metals and carcinogens. The nicotine levels can be very high because certain devices are not regulated, so we're not even sure how high the nicotine levels are. And then the overheating increases toxins and risks. So there's been some things in the news I'm sure you've seen of people being poisoned or having to go to the ER based on the high temperature of the devices. The dangers of vaping, just in general, is really important to cover is really these first two, which is the impact on the developing brain. I think right now we're kind of in like an uphill battle around both marijuana and nicotine because they're both kind of culturally and societally seen as something that's not as harmful. But when we're talking about young people, it is. And that is because your brain is not developed. You don't have the mechanism to stop. And what that does is it sets you up at a risk for not only addiction in the future, but using other substances. And then the other issues are respiratory issues, vapors, cough, nosebleeds, ear, eye and throat irritation, gum disease, nausea, secondhand and third-hand aerosol effects, and then a bridge to cigarette smoking. So these physical aspects also kind of match what you would think happens with cigarette smoking. And I think one of the big misnomers is that, oh, this is healthier, but actually nicotine, whether it's in cigarettes or in vaping devices, is impacting your circulatory systems. This is where all your blood's going. And that's why it's affecting your nose, your ears, your eyes, your gums. It is a circulatory issue, and nicotine is impacting that, not really dependent on the vehicle it's coming through. And obviously the aerosol is a different smoke than cigarette smoke, but it's still going to impact you in your lungs. So that's just something to keep in mind. And then before we go into marijuana, this is just a friendly reminder that it is illegal to sell these products to anyone under the age of 21. And so I sometimes think we forget that because somehow teens are getting a hold of these devices more and more frequently. But it's important just to remember that it is illegal, just whether you want to remind parents or yourself or even your local shop owners, it is illegal. And there's also another thing that just came out. I don't know if you all know this. House Bill 11 was passed in Kentucky. I can send a few links to that. It's a complicated bill that just passed. It goes into effect January 1st, but it is more regulations on these vaping devices and which ones they can sell. And so it's a bit controversial, but I'll send you the links to those. But just to let you know that at the state level, they are trying to figure out how to prevent young people from buying these devices. Okay, on to cannabis. We have one trivia question. It's worded really weird, so I don't know how. But basically, if the question is, are young people today, are there higher rates of young people today using marijuana than they were in the 70s? So what do you think? True or false? Okay, we have true, true, true. True, true. Give you a couple more seconds to answer. We have one false, couple false. Okay. All right. Yes, this is kind of a trick question. It is false. In the 70s, there were more teens using marijuana. There was about 50% of 12th graders in the last year who had used marijuana. And today there's about 30%. So there is a decrease, but it's still an issue now because we're seeing a different version of marijuana than we were in the 70s. And we're going to talk about that. So what are some of the marijuana trends at the moment? It's been increasing steadily over the past couple of years. I mean, this is related to a lot of things, the culture, media, that it's healthier. Certain states, it's more legal. The medicalized version has come out as well. But there's lots of different ways that you can use it now and in different forms. So you can eat it, you can smoke it, or you can vape it. And all of these have different mechanisms of action, and they also all have different levels of THC, which is incredibly important to be aware of. So here are some basics for people who don't know. Cannabis is just the name of the plant. So that's why it's called cannabis. It's the like very technical Latin name of the plant. Sorry, 1 second. Okay, and then the active ingredient is THC. So that's what causes the high. And THC stands for tetrahydrocannabinol. And basically all you need to know is that's the ingredient that gets somebody high. And then there's CBT. They do not have any psychoactive components. And CBD stands for cannabinol. So what we're going to talk about today is mainly THC and why it is a problem at the moment, because this landscape has changed so much in the 20 years that, you know, there's different strains, they're modifying it to have higher levels, and then different forms of it have higher levels, which cause more adverse effects.
Natalie, I was just going to jump in, and I'm sure you saw
Yeah.
there was a comment that I think Monia made about the levels of THC. So eating into what you were saying, that it's so much higher. I often tell my parents who are kind of like, well, it's no big deal. I smoked weed when I was young, that this is not your mama's marijuana. This is
Yeah.
a whole nother level of THC that's available in that genetically modified plant, which means the potential for a whole nother level of addiction for our kids. So I just wanted to share that in case others had that same question.
Yeah, definitely. Thank you, Tasha. Okay, so what is THC? The thing that I think is important to remember is really that it's a multi-action drug. So nicotine is simple, right? It's a stimulant. It gives you a buzz. It gets out of your body pretty quickly, and then you just want to keep using it again. Alcohol is depressant. It's a downer, right? It makes you kind of feel low. You know, you have a little spike of euphoria, but most of it, you know, it's a depressant on your system. And we know that mechanism of action. The thing with THC is that it's a stimulant, a depressant, and an hallucinogen all at the same time. And all of these yellow parts on the brain is where THC acts upon. And so these are lots of different areas, including judgment, movement, coordination, memory. And so you can see that if the higher level of THC is there, it's going to impact all these areas. And because this is so new, we're not even sure how much of an effect this is going to have in the future. But what we're seeing now is quite concerning. The other thing is that THC lingers in the brain and body. It does not come out quick. And that also has effects, especially when you're experiencing a high for a long period of time and you're a young person and you're not know what's going on. And so that's why we're seeing emergency room visits. We're seeing psychotic breaks. We're seeing a lot of ill effects from these high levels of THC. So like I said, methods of consumption, this is eating, smoking, or vaping. So THC levels in the 60s and 70s, if you smoked marijuana, was between 0.5 and 1%. In the 80s and 90s, it went up to about 3 to 4%. And then now, if you smoke dried leaf marijuana, it's about 16%. So when you start vaping or consuming edibles, the THC level increases to anywhere from 40 to 99%. And you can read more about this from a really great organization called the Smart Approaches to Marijuana. They have a website with lots of data, lots of information, but this is just a snapshot to show that it's not just a slight increase. This is a huge increase in the potency, which is why we're seeing so many ill health effects from cannabis and marijuana use. And here's just an example of all the ways that it can be vaporized. So these are vapes, it's heated, and it's just THC oil. So that's why it's so much more potent. It's not from the plant. You're not smoking it as it's attached to the plant still. And yeah, there's lots of different evolutions of this, but that is what is being vaped. And this is just an image to show how much of an increase it is. So if you compare this to caffeine, it would be the equivalent of a comparison between just one soda or pop to 33 cappuccinos a day. So it's a very big difference. And that is why, the big thing we're up against is that cannabis is seen as a healthier version of things. But when you're at a potency of this level, it's not healthy for your brain and body. And some of the effects that we're seeing, that you would never say this like 10 years ago, but you can have a dependence to marijuana. And that is because the THC levels are so high. And so it's actually been termed a cannabis withdrawal syndrome. And this is in the diagnostic manual for mental health disorders. So when I used to work at an addiction facility, I worked with a lot of like 27 to 28-year-olds who are struggling so hard to quit smoking marijuana. But they were dependent on it. Your body becomes dependent on it. And when you try to detox, these are some of the symptoms that you have. So this is just to be aware of. It's controversial now. We're coming up against a lot of beliefs around that it's healthier for you, it's better for you. But actually you can become dependent. Here's some new research that has come out in 2023. So teenagers who use cannabis recreationally are 2 to 4 times more likely to develop a psychiatric disorder than teenagers who don't use at all. This goes back to the statistic I said about alcohol. If you delay your use, you are significantly decreasing your risk for not only addiction, but with marijuana, it's mental health issues. There's also a high risk with men and schizophrenia. And then as many as 30% of cases of schizophrenia among men might have been prevented if they had not used cannabis. Some other concerns that we're aware of are just what I've already mentioned. There's an increased risk for addiction. There's some interesting research out there about IQ and certain levels of IQ decreasing after long-term abuse. And this is because cannabis or marijuana impacts a certain part of the brain related to learning and memory. Driving, that's kind of obvious. It's the same as alcohol. You have less coordination time. You're not concentrating as much. You shouldn't be driving if you're smoking marijuana. Mental health, like I just said, there's a lot of mental health risk. And then there's also something called amotivational syndrome. So this is losing all motivation to do anything, especially in the detox period. So it's really changing your behavior. And then lung health. So it still is an irritant to your lungs, whether it's vaped or smoked. And it can have certain chemicals related to tobacco smoke. Okay, so that is just our overview of alcohol, nicotine, and cannabis. And then I'm just going to briefly touch on addiction and some prevention resources. And then I'm going to stop sharing so we can have just a little bit of a conversation. So the definition that's used here is that addiction is defined as a chronic and relapsing brain disease that is characterized by compulsive drug seeking and use despite harmful consequences. And it's considered a brain disease because repeated use is going to change some of the structure of your brain. And it's not that that can't be reversed. It just gets harder to reverse the older you get. So that's why it's really crucial with young people that we intervene now, because there's so much potential in this period of their development that we can either nurture and grow into those strengths, or if we kind of put in these not so positive things, they're going to learn those quicker and then have a higher risk of developing difficulties later on in life. And so I kind of see it as like there's 2 periods of development, 0 to 5, which is when you're like learning to walk and talk, and that makes sense. But then the other area, which is often neglected, is ages 11 to 14. And that's another area where your brain is really active and it's incredible. You're learning all these new things. And that is because of puberty, but also because you're, becoming an adult, you're becoming your own person. You're developing skills that are going to make you, succeed in life. So if we start using substances in this phase where they're learning things so rapidly, they're going to learn a negative behavior without having a part of their brain that's developed. And this is related to the reward pathway. We all have one, but we have more control over it because our brain is more developed, whereas young people do not. So it's a little bit bleak, but there are things that we can do. There's protective and risk factors. So the protective factors to be aware is delaying your use and having people around you, your parents, your friends, your school environment, that know that this is harmful and don't have kind of this these ideas around it that, it's okay to use and it's fine and it's not a big deal. But actually having those boundaries around you that's like, actually, this isn't great for you, and I care about your health and your future. And I don't think you should be doing that at this point. Having healthy role models, having high resiliency factors, and having little or no access are also there. And with Caron, we focus on all these areas. We tried to intervene at these areas because we think it's really important to focus on those. So why is prevention important? It's important because why not act now, then clean up the mess later on? If we can do something now, why don't we do that? And especially with children, this is about attitudes and beliefs. A child develops their own attitudes and beliefs about the world because of those people that are around them. And so if we can kind of hold that space for them to know that actually we're in an agreement that you shouldn't be using before you're 21. And then also, like I said, a young person's brain's still developing. It's way easier to intervene now than later on in life. So here are just a few prevention strategies that I'm going to go through. We have a lot more in-depth presentations around this if you're interested. But I'm just going to go through these quite quickly. So one thing is just being able to talk to teenagers about alcohol and drug use. I know it's easier said than done, but we do have some tips around that. But it's really just being able to talk in a non-judgmental way and also having them be aware of the risk. So plan strategies if they're unsupervised, whether that's getting involved in clubs, getting involved in friend groups, maybe an organization that's doing volunteering. Provide up-to-date information about the risk, right? It's a very nuanced approach to say, I really care about you and I'm not going to judge what's going on. And at the same time, I want what's best for you, and what's best for your brain and body is to delay using, and I'm going to hold you accountable to that. So I think that's really important. Talk about their future goals, have that future thing in mind that they're working towards that's positive. Another one is just don't joke around or trivialize it, right? Take it seriously that this is impacting their brain and their development. Promote accurate norms. So that's the norms we've been going through in this presentation. Most young people are not using substances, despite what maybe their friends are doing, what they're seeing in the media. Most are not. Just keep an open mind, and then also just be optimistic, positive, reward them for the positive things that they're doing, and be a good listener. Some tips for early intervention are just don't ignore the signs. Speak in what you observe about the signs that you do see. Keep an open mind, express care, and then follow your organization's policy around confidentiality and whether you need to involve parents or outside support. Okay, so I think we have about hopefully like 15 minutes left. But the first thing I'd like to talk about is really just what you're seeing in your school right now. So what you're seeing in your school right now, and then is there anything that you're currently doing to address these concerns, and maybe how is that going? So I'm going to stop sharing so I can see you all. There we go. So would anyone like to share that? That's really just, what are you seeing in your school at the moment, and what's being done that's maybe working or not working?
I'll talk.
Okay, hi.
How you all doing? My name is Monia Logan. I'm from Jefferson County Public Schools. I am
Nice.
a youth services coordinator. Um, and I haven't seen it so much this year,
Oh,
but last year we had a lot of vapes that
mm,
we had to confiscate throughout the year. And what they do in order to keep it on them, they will like, of course, hide them in their pants or something somewhere that we can't search. But we would go into like a bathroom and the bathroom would smell like marijuana or anything like that. So we know exactly what it is, and we usually know with the kids, but because we can't physically see it, you know, it it was a very we couldn't prove it. But one of the things that I did, we're currently working on MOA for them to be able to return because we don't have an agreement on file. But um, Operation Unite, we brought their On the Move program here to Crosby last year. And I think that went really well. They allowed the kids to utilize the simulation goggles
mm,
and drive the bikes as well as the go-karts. And then they also had a mobile classroom that they talk about the dangers of vaping and things like that, and pretty much saying, how back in the day, the tobacco company used to want tell people that it was okay for pregnant women to smoke cigarettes. So
mm.
it just pretty much showed like the ads from then and how they've always lied to people to get them to
Yeah.
understand like vaping ain't safe. They show a little cute video. I think they play Bad Boys, what you gonna do? And they show episodes of where kids' vapes caught on fire just randomly, like one caught on fire in a kid's pocket in the cafeteria and things like
Yeah.
that. So it was like a mix of videos that they showed the kids. And what I did after that, after they went through that, I did it for my seventh and eighth graders.
Mm,
What I did after that is I gave them a one-time get out of jail free card. If you need any assistance with trying to
mm.
help to stop vaping, if you have a vape that you want to get rid of, instead of you getting like a punitive consequence, you can come see me. That's your get out of jail free card without getting any consequences. And I can meet up with you to try to see if I can get some services to put in place to help you stop.
Nice. Thank you for sharing. That's very information. That was very insightful as well. I think the video you talked about, it's so important to make it relevant to them as well, and just be like you said, this isn't safe for you, and they have a history of lying. So
Right.
it's a really good messaging to.
And I have I really like even the video that they show as it relates to the vapes catching on fire. It was like someone
Yeah.
standing at a bus stop waiting for the bus. It was someone sitting in the cafeteria. So it wasn't
Mhm,
like older people necessarily that the
mhm.
vapes are, catching on fire with. They literally utilize young people's videos to capture
Yeah,
the youth.
definitely. Thank you, Monia. Anyone else would like to share maybe what they're seeing and what's being done in your school? In the chat, we have just that they're sneaky, right? It's at younger ages, and these disposable devices are so easy to hide, and bathrooms are definitely the hot spot for sure.
As a FRC, I'm Donna Willem. I'm at
Hi, Donna.
Hey, I'm Knox County at
Nice.
Jerrington. As FRC, we have P through fifth grade now. So
Okay.
we're not really vaping, and substance use is not a topic right now, but we do still address it with programs, and
Mhm.
modifying those. But we're hearing our students identifying them. Like they don't really know that it's called a vape, but they know mommy and daddy put something to their mouth. Their smoke comes from it. So they don't know the terms
Mhm.
just yet, but it's more about their behaviors. Mommy and daddy are fighting, they're putting something in their drink. They don't really understand. So that's more the language, what we're seeing as FRCs. I see a lot of other FRCs on here, but not sure. It's more the students telling those things to us. And they'll say, I know I shouldn't do that. You know,
Mm,
it's more about the preventive for them. Like you said, this is your body. We're trying to keep you safe.
mhm.
But then some will cry and say, oh no, I see my mommy do put something in her mouth. So
Right.
you just have to really be careful there.
You do have to be careful, and I'm so glad you brought that up because it is a very important area that fits within this, which is that there are children who are in homes, and that people mentioned that at the beginning, that they're interested in learning about, especially younger children who are in homes where there is some use going on, and how do we support those children? And I think it's a very important, like you said, but nuanced conversation to have because of what they're seeing and how to support those children in the best way we can. And so we do have some resources around that in a
And
presentation. So
yeah, and keeping them safe too from picking
yeah,
that up and use it, seeing what it is. Kids are curious, we know that, but they want to pick up everything. So that's conversations that we're having. And someone mentioned the Unite. We work with Unite as well. And we've got a new guy that's came on the horizon. And he came to my back to school and he explained to me 7 years ago he was homeless with drug addiction.
wow.
So he just said, I went to jail. And that was life changing for him, obviously. And he said, when I got out, I kind of said, I've got to turn my life around. He had
Mm.
children and just got himself together. And now he's a huge advocate and he's coming into our schools. He's making himself available. I'm here. Tell me how I can help. And so he's chose to modify things down for our younger people. And so that's been very, very helpful. And we work with Unite. They offer a lot of scholarships and they're always willing to come in our schools during Red Ribbon Week and just work and help anyway. So we have our SROs in our building to prevention as well. So we have a lot of support in our district.
Good. That's really great to hear. And that's another really great thing about having kind of these calls with everybody here is if you do know of those resources, you can share them in the chat. We're just one type of resource, but we don't.
I think Natalie, I
Okay.
think she froze up on us. Yes.
I think Natalie might have froze up. I know we're hitting on 5 minutes, so I can kind of jump in for her and then kind of wrap things up. I wanted to share a couple of things that came across, and I think one of the things she talked about was just being aware of all of the resources available. For Caron and for Natalie, we're definitely available to come in and provide support for those students that might be currently using those products through some of the programming that we offer, specifically education around vape and helping those kids that are currently using it. I love the example earlier where it's like, if you need a space to be able to come in and support, we're here to do that because we have to be able to allow those kids to create a space where they feel safe enough to talk about the things that are impact them. Want to give one website as Natalie's getting together, drugfree.org, because a lot of folks talked about how do we deal with parents that are currently using. On drugfree.org, we do parent education programs, but drugfree.org has a script, talking points, not just for parents who may be currently struggling with addiction, but really giving tips on how to talk to kids when they're observing things like you just talked about, God, I'm seeing people, put things to their mouth, or I'm seeing people use pills. How can you talk to them about what's safe and okay and what isn't? Natalie, are you back on? I'll let you.
Yes.
Okay,
Can
I'll
you
let
hear
you
me?
go for the last couple of minutes.
I'm so sorry. I was worried my internet was going to do that, and it did. So, my apologies. So for the last couple of minutes, I'm just going to let you all know what we do, what we offer. And then really, this is just, like you said, what I was trying to say before I got off was we are all about collaboration. So we work in tandem with lots of other organizations because we think creating substance-free youth is a team effort. So if we're all working towards the same goal, we'll have more impact. So take this if you would like. And we're also really open to lots of different ways of collaboration. So I'll leave my contact information in the chat and we can discuss that whenever you would like. So here's just a map of our geographic reach. So like I said, Pennsylvania is really our hub, but we've worked in all these different states for upwards of 15 years. And so we have strongholds in a lot of the schools, and Tasha and I's colleagues in different states, we learn from them. We learn from different school districts. We learn about different approaches. And in the 2021 and 2022 school year, we impacted over 53,000 young people in 630 schools. So our core offerings are really around youth, and then we also have some adult capacity building programs. I think we're going to give you this information, so don't worry about writing this down. We can follow up and give this to you. But for our prevention services, we have classroom presentations that we do around the harmful effects of nicotine and marijuana. And then we also have one about the brain. And then we have a peer leadership program where youth are trained to deliver clear facts to their peers. And then we have early intervention programs. So we have 2 cessation programs, one for nicotine and one for marijuana. And then we have a diversion program, which is an alternative to suspension. And then we have virtual options as well. And one of those is Connect 5. This is for teens to self-lead themselves. So this is an option that's available through our website at the moment, available to you now. And then our professional trainings, we have digital learning. We have a toolbox training like this. We have a couple others that we do that we can do virtually or in person. And then the one that I think is most important for you all, just because there's only one of me and the whole state of Kentucky, is a Project Connect facilitator training. So Project Connect is our 8-week nicotine cessation support group. And I can train you all to facilitate that program in your schools. The curriculum's free. And you can do that for your student body. And here's our digital learning program link. You can go online and see these resources for you. And then we have a whole host of resources for parents as well. We have some amazing prevention videos on our YouTube channel designed about how to talk to your child, but also just information that parents need to know. Our prep program is a 45 to 60-minute presentation that we do for parents. And then we have a resource kit online as well, and a podcast. Forgot to mention that. I always forget the podcast, but the podcast is really great. And then some conversation cards that you can print off. So basically there's just lots of stuff available for you all, and we will get this information to you so that you can have access to it. A lot of it is available on our website. And then I'll stop now to see if there's any questions, any last minute things that we can answer for you. And then if not, I'll put my email with you all so we can contact each other. Okay, good. Tasha's got that covered. So my email's in the chat, but any other questions? Thank you so much for spending your hour with me during your busy day. We really appreciate it.
Can you say a little more about the Train the Trainer program? What exactly is that again?
So that is a Train the Trainer program for Project Connect, which is an 8-week support group for nicotine cessation. So you can use that in multiple ways to support kids who are trying to quit, or some people use them as like a support after having a one-time offense. But you can enroll kids in that for up to 8 sessions, and then you're trained in that.
But I know you mentioned before you have kids come to you to say, "Gosh, I'm using, but I really want to quit," or I need some support.
Yeah.
Project Connect would be the curriculum that you could use to get a group of those kids together and run that 8-week group to support those kiddos that are coming to you anyways.
Also, Monia, I have trained some of the Friskies and JCPS in this program as well. So if you want to reach out to me after this, maybe we can coordinate to get a group of people in Jefferson County. But if other people are interested in other counties, we can do that as well. If we get a group of people, we can all train together for that Train the Trainer program. So just reach out about that. Any other questions? Okay. Quentin, do I just wrap it up? Or are we good? We're good. Okay. Well, thank you all so much. Thanks to